How to make up a ceftazidime 2 mg in 0.1 ml solution. Use the ceftazidime intravitreal injection monograph throughout the manipulation. Select ceftazidime kit from the box of endophthalmitis kits. This contains everything required to make up the ceftazidime intravitreal injection. Put on a pair of non-sterile gloves and use good aseptic technique throughout. Select ceftazidime 1 gram dry powder vial. Caution: ceftazidime is also available in a 500 mg, 2 gram and 3 gram vial. Check that the vial strength is 1 gram before preparing the dose. Prepare the 10 ml syringe for use by applying the needle to the syringe using aseptic technique. Leave with sheath in place. Prepare the air vent using aseptic technique by applying the needle to the filter. Screw needle onto air vent. After swabbing the top of the ceftazidime vial with an alcohol wipe, unsheath the needle and insert into the vial. Unsheath the needle attached to the 10 ml syringe and withdraw 8 ml water-free injection. Use this to reconstitute the ceftazidime. Ensure that the needle point of the air vent is within the air portion of the vial at all times and not submerged in fluid. Gently shake the vial to dissolve the powder. Carbon dioxide will be released and a clear solution should be obtained in 1 to 2 minutes. Using a new 10 ml syringe, withdraw the entire contents of the vial, ensuring the needle point of the air vent is as described. Be careful not to push back into the vial, as this may lead to a blockage in the air vent. Make up to 10 ml with water-free injection, giving a 100 mg per ml solution. Draw back approximately 1 ml of air and invert syringe several times to mix, then readjust the plunger to remove the air. Using one of the transfer devices provided within the kit, transfer 1 ml of the 100 mg per ml solution into a new 5 ml syringe. Transfer device should be screwed onto syringe. If required, you can adjust the plunger in the 5 ml syringe to achieve the required volume and remove air bubbles. Make up to 5 ml with sodium chloride 0.9%, giving a 20 mg per ml solution. Draw back approximately 1 ml of air and invert syringe several times to mix, then readjust plunger to remove air. Attach a new filter device to the 5 ml syringe containing ceftazidime 20 mg per ml solution, then attach a transfer device to the filter device. Filter device should be screwed onto syringe. Transfer device should be screwed onto filter device. Prime the filter by pulling ceftazidime 20 mg per ml solution into a 2 ml syringe until you see approximately 2 drops of the solution fall into the syringe. Discard the 2 ml syringe and its contents. Transfer 0.5 ml, 10 mg, into a new 1 ml syringe via the filter. If required, you can adjust the plunger in the 1 ml syringe to achieve the required volume and remove air bubbles. Discard the 5 ml syringe, transfer device, and filter device. The final solution in the 1 ml syringe contains ceftazidime 2 mg in 0.1 ml, which is equal to 10 mg in 0.5 ml. Administer 0.1 ml of the final ceftazidime solution by intravitreal injection and discard the remainder.